Are you a man, or do you know a man who wakes up all night trying to pee, struggles to empty their bladder, starts to notice even a little dribbling after they pee? Then this video is for you. It's going to tell you the best medication with the least side effects you should consider to help improve your symptoms. I'm Rena Malik, urologist and pelvic surgeon, and today we're going to talk about the best medications for benign prostatic hyperplasia, or BPH. And BPH is essentially just an enlargement of the prostate gland. And this is a gland that's a walnut-sized organ located below the bladder in men. And as it gets bigger, it can squeeze the urethra, or the tube that carries urine out of the body. And this then leads to the symptoms I described, including things like going to the bathroom often during the day, having to go, like gotta go to get to the bathroom, having a weak stream, or one that even starts and stops, or one that you have difficulty starting, and feeling like you sometimes can't empty your bladder fully. Now, if you have these symptoms or know someone who does, you're not alone. 50% of men over 50 and 90% of men over 80 have an enlarged prostate. And a lot of these men will need medication. So what can you do about it? Well, there's several treatment options that I've reviewed on this channel as well as my podcast multiple times before. But one of the most common first-line treatments are medication called alpha blockers. Now, these medications work by relaxing the muscles in the prostate and bladder. This allows urine to flow better through the urethra, and ultimately you have less pressure required to force that urine through. Now, here's the thing. Most often, you'll go to the urologist and they'll give you a medication and send you out the door. But did you know there are 6 different types of alpha blockers? So which one is truly the best or right for you? So in order to figure this out, I'm not alone. Researchers conducted a massive network meta-analysis. Now, this is a study that combines data from a whole bunch of different clinical trials that allows them to compare multiple treatments at the same time. Now, in this study, they looked at 22 randomized controlled trials, meaning people took a pill or took a placebo to see if it was beneficial, which included ultimately 3,000 men with BPH. And in this trial, they compared those 6 different alpha blockers at various doses against a placebo. Now, why are there different kinds? Well, alpha receptors, which these medications work on, have several different subtypes. Now, while some are specific for the bladder or the prostate, there's also some that work on blood vessels. And so these medications vary based on what of these subtypes they block. So what are these medications? So silodosin and tamsulosin are 2 of the most commonly prescribed medications. And these are highly selective for alpha 1A, which is on prostate cells, and alpha 1D, which is on bladder cells, making it what we call uroselective. So it's very specific for urologic symptoms. Another medication is called naftopidil. Now, this one is only available in Japan. So for my Japanese viewers, this is a very specific medication for the alpha 1A subtype. It has a significantly higher affinity for that receptor, making it potentially more beneficial for prostate symptoms. Now, the other medications are less specific. So they also have effects because they work on these other receptors. So sometimes you will see more cardiovascular symptoms with them because they also affect blood vessels. And that's alfuzosin, doxazosin, and terazosin. So in this study, they compared those 6 agents and they assessed several different outcomes. One is a symptom score, or the International Prostate Symptom Score, the IPSS. And this measures how severe these symptoms are, as well as how they affect your quality of life. They also measure something called a post-void residual volume, or a PVR. And this tells us how much urine is left in the bladder after urination. And they measured a urine flow rate, or a Qmax. And that's essentially when you pee and your urine flows out, and how fast in milliliters per second does that flow. And lastly, they tracked what we call treatment emergent adverse events, basically side effects. And so what did they find when it came down to looking at which medication reduced the symptom score the most, meaning which was the most effective in improving symptoms? Tamsulosin, or Flomax, at a dose of 0.4 milligrams emerged as the winner. Now, they didn't look at 0.8 milligrams, which is the highest dose. This was followed by that Japanese medication naftopidil and then silodosin. In terms of tamsulosin, it also showed the highest probability of improving the post-void residual, which was again again followed by naftopidil and doxazocin. Tamsulosin also improved the flow rate the greatest, followed by terazosin and then silodosin. So ultimately, in my mind, quality of life, of course, matters most, but it really depends on your individual symptoms. So if you have a low or weak stream and that's bothering you the most, then if tamsulosin doesn't work, maybe terazosin would be better for you. If you're not emptying your bladder well, and that's what you've seen in the urologist office, if tamsulosin doesn't work well, then maybe doxazocin is a good option for you. These are important things to know when you're taking care of a patient who has enlarged prostate, but also for you to know so you can advocate and say, hey, this medication isn't working. Maybe we should try this one. Now let's talk about side effects. Side effects from these medications can be dizziness, low blood pressure, fainting or falls, shortness of breath, and orthostatic hypotension, which is basically when you stand from sitting, your blood pressure drops. It can also be headache, retrograde or anejaculation, and floppy iris syndrome. Now, the floppy iris syndrome is something basically that you need to worry about if you're going to have surgery on your eyes. Your ophthalmologist will be very disappointed if you've taken one of these medications because it will affect your iris and make that surgery more difficult. So what about special scenarios, right? I have older patients who are fall risks. I have people who are very concerned about ejaculation. So what do you want to do in those cases? If you want the least retrograde ejaculation, alfuzosin appears to have the lowest rate of ejaculatory side effects, with only about 0.6% of men having some ejaculatory dysfunction. Now, I'd say usually it's less than 2%. Whereas silodosin, for example, has a much higher rate, almost 20%. If you have high blood pressure and you want to take something that will help your blood pressure as well as your BPH, terazosin and doxazocin can be used for high blood pressure as well as BPH. Now, when you do studies in the literature to find these side effects, often they're funded by the pharmacologic manufacturer, right? So I found a study that looked at the FDA adverse event reporting system, which essentially takes the number of reported side effects from any given medication or treatment and logs those, as well as the medical expenditure panel survey, which looks at the number of patients that take a certain drug. The study looked at these both over 7 years to find out exactly what side effects were going on. And what they found was that doxazocin had the highest overall rate of side effects, followed by alfuzosin, then prazosin, which we didn't mention, but is another medication similar, followed by tamsulosin, and last terazosin. And those last three, prazosin, tamsulosin, and terazosin, had similar rates and generally had lower rates of side effects compared to alfuzosin and doxazocin. When you break that down, falls, alfuzosin had a significantly higher rate of falls. Low blood pressure, both doxazocin and alfuzosin had higher rates of low blood pressure. Dizziness, fainting, shortness of breath, or headache, doxazocin had higher rates of all those compared to the other alpha blockers. I think an important thing to realize is that falls or dizziness are very common as men age, or as anyone ages really, but it does become a real problem because remember, when people have BPH, oftentimes they're getting up a lot at night. So you get up a lot at night, you're already at risk for a fall when you're walking to the bathroom, but then lo and behold, you're on a medication to help you wake up less, and that might make you dizzy when you stand up. So if you're struggling with orthostatic hypotension, you want to talk to your doctor about being on a more selective medication, meaning something like tamsulosin or silodosin, which might reduce the risk of orthostatic hypotension. So what if you have erectile dysfunction? So before I tell you which alpha blocker to take, you may want to consider taking a daily dose of tadalafil. Tadalafil is Cialis, or medication you take for erectile dysfunction, but it's also been found to be beneficial for men who have enlarged prostate. So instead of adding another medication or taking two separate medications, you could just take one, tadalafil 5 milligrams daily, and that will help both your erections and your BPH. So if you are, however, doing well on your medication for erectile dysfunction and you'd rather add a different medication so you don't mess with things that are working well, the medication that was found to have a slight improvement in erectile function was naftopidil. Now, unfortunately, we don't have that in the United States, but it was shown in a study to improve erectile function in men with BPH. And the thought is that it might be because it has a slightly different mechanism of action. It seems to be a little bit more selective in the way it targets these alpha receptors in the body, and so that may mean mean that it has a more favorable impact on blood vessels, so relaxing the blood vessels to the penis, which then allow for better erections. Now, in theory, that should work for all of these medications. However, they did see this in one small study. Another interesting study looked at things like high cholesterol, blood sugar, as well as blood pressure. And they looked at, are there certain medications or alpha blockers that actually were more favorable for those parameters? And so in this small study, it was like 60 men. They looked at those who started alpha blockers, and they found that both the systolic and diastolic blood pressure, meaning the top number and the bottom number, the total cholesterol, as well as specifically the LDL cholesterol, and hemoglobin A1C levels, which are a marker of your blood sugars over the last 3 months, were significantly decreased in the doxazosin group compared with baseline, as well as being compared to men taking tamsulosin. Now, this is a really small study, but it may be of value if you are someone who has these other issues and you don't have side effects with the doxazosin. It might be something to consider. So bottom line, what does this mean? If you have BPH and considering medication for treatment, tamsulosin 0.4 milligrams and possibly 0.8 milligrams, I don't know based on the data, appears to be a strong contender because it not only effectively manages symptoms, but has pretty low side effect profile and most people tend to tolerate it well. Certain medications might be better for you than others if you're having specific concerns like having issues with lower ejaculate volume, blood pressure, or dizziness. In those cases, refer back to the video to figure out what is right for you. Now, if you guys are enjoying my content and you are not subscribed, I'm not sure what you're waiting for, guys. It is a zero cost, free way to support the channel. So please do so. It means the world to me and also helps me get this education out to more people around the world who really, truly need it. So thank you guys so much. And as always, remember to take care of yourself because you're worth it.